Hello everyone. Today we are going to present our research titled Post-Traumatic Stress Disorder, Emotional Non-Acceptance and Anxiety, Latent Growth Modeling. We conduct this study with several colleagues, and today three of others deliver today's presentation. Let us introduce ourselves. My name is Yongsu. I'm a third year doctoral candidate uh, in the Department of Rehabilitation Psychology and Special Education at the University of Wisconsin-Madison.
Hi everyone, my name is Gina John and I'm an assistant professor in the same department at the University of Wisconsin-Madison.
Hi everyone, I'm the third presenter, Chani Kang. I'm a master candidate in the Department of Human Ecology and Technology at Handong University, and I work with the Job and Social Rehabilitation team at the Korean Association Against Drug Abuse.
Here are the learning objectives for today's presentation. First, we identify a longitudinal trajectory of emotional non-acceptance and anxiety across multiple time points to figure out their developmental progression. Next, we examine the dynamic temporal association among PTSD, emotional non-acceptance, and anxiety, with focus on how initial PTSD influence subsequently emotional non-acceptance and anxiety. Many studies have shown that experienced traumatic events increase the risk of PTSD and anxiety. Um, a meta-analysis revealed that individuals with early trauma are more likely to have an anxiety disorder compared to those without early trauma. In addition to this, war veterans with PTSD are likely to develop anxiety disorder. Emotional non-acceptance, one of the emotional regulation strategies, is defined as an unwillingness to experience one's emotional state and the tendency to cognitively and behaviorally avoid them. According to the previous research, emotional non-acceptance is one of the key predictors of PTSD and anxiety. Especially, the emotional processing theory explains that the way of processing emotional information related to traumatic event, especially the fear, structure, and function. Based on the emotional processing theory, the emotional non-acceptance can prevent sufficient activation of fear structure, result in the failure of emotional modification. Regarding PTSD, people who reporting higher level of emotional non-acceptance experience more severe PTSD symptoms. And about anxiety disorder and anxiety, emotional non-acceptance was found to amplify the link between anxiety's sensitivity and anxiety arousal, and emotional non-acceptance increased overall anxiety among adolescents who experience traumatic event.
Now, I'd like to continue by exploring how these cultural patterns impact emotional non-acceptance, especially in trauma-exposed populations. In collectivist cultures like Korea, emotional regulation is often shaped by social relationships. People tend to manage their emotions in ways that maintain harmony, such as using suppression rather than open expression. Research shows that individuals from collectivist society prefer emotional suppression, while those from individualistic cultures are more likely to express emotions. This difference reflects cultural values around group harmony and personal autonomy. For these reasons, BESK highlight how emotional regulation is influenced by social cues and relational concerns. Beyond the cultural context of emotional regulation, it's also important to consider how emotional non-acceptance may influence the development of PTSD symptoms over time. Longitudinal research shows that PTSD doesn't follow a single path. For example, individuals with high initial levels of post-traumatic stress often experience worsening symptoms, while those with lower initial distress tend to remain relatively stable. More recently, study identified four distinct symptom trajectories: consistently low, moderate and rapidly declining, moderate and slowly declining, and consistently high. Each of these patterns was linked to different levels of functional impairment and depression. These results indicate that understanding the development of PTSD symptoms required precise observation of within-person change, thereby underscoring the importance of longitudinal approaches. Next, I cover research gaps and our objectives. Longitudinal evidence on how PTSD unfolds over time and how emotional non-acceptance mediates PTSD linked to anxiety is still limited. Most studies are cross-sectional, which prevents us from capturing within-person change or establishing temporal order. To address this, we use a longitudinal design with two aims. First, test whether emotional non-acceptance and anxiety change gradually over time. Second, examine whether initial PTSD predict the trajectory of emotional non-acceptance, which in turn predict the changes in anxiety. By modeling trajectories and temporal sequencing, we move beyond static snapshots and clarify how PTSD relates to later non-acceptance and anxiety. Next, I will introduce the method of this study. In this study, participants were recruited through an annual online survey conducted in South Korea across 3 webs from 2018 to 2020. All participants had experienced at least one traumatic event meeting DSM-5 criteria for PTSD. Details on the survey period, sample size, and response rate by web are shown on the slide. Next, to assess key variables in this study, we used validated instrument. First, PTSD symptoms were measured using the PTSD checklist for DSM-5. Next, emotional non-acceptance was assessed using the DERS-16. Lastly, anxiety was measured using the BSI-18. The slide presents each instrument, item numbers, Likert scaling, and Cronbach alpha. Next, I will present the data analysis for this study. Examine how PTSD relates to change in emotional non-acceptance and anxiety over time. We conducted latent growth modeling. We first compared two models. First one is no growth model, which assumes no change in emotional non-acceptance and anxiety, and a linear growth model, which assumes a consistent increase or decrease. Model fit was evaluated using standard indices. Next, we examined the association between PTSD and changes in emotional non-acceptance and anxiety were investigated by testing a model based on the hypothetical relationships. To assess mediation effect, we conducted sober tests to evaluate the significance of indirect pathways. This analysis helped clarify how PTSD may influence emotional process over time.
Now let's look at the result. As for the demographic, average age was about 40 years and slightly more than half were male. Most were college graduate and employed full-time and married. Regarding the correlation result, PTSD was positively correlated with emotional non-acceptance and anxiety at all 3 time points. And emotional non-acceptance was also consistently related to the anxiety at the all 3 time point. Now let's discuss detailed result of the LGM. First, we choose model 2, in other words, linear growth model for the 2 variables after comparing the model fit as shown the red and green line. The model index indicates that the model 2 for both the emotional non-acceptance and anxiety has better result. Next, results show that emotional non-acceptance increased over time, but anxiety did not significantly increase over time, as shown the purple line. Lastly, individual difference exists in emotional non-acceptance at the beginning, but anxiety showed that the difference both initially and over time, as shown the blue line. In other words, regarding emotional non-acceptance, the average change trajectory may differ systematically, but individual difference exists in only the initial levels. While about anxiety, the average change trajectory may not differ systematically, but individual difference exists in both the initial level and the rate of the anxiety change. Before examining the mediation model, we conducted autoregressive modeling to investigate the temporal order between the emotional non-acceptance and anxiety. Results show that in our current data, the emotional non-acceptance precedes anxiety, aligned with our studied hypotheses. Past analysis showed that higher initial PTSD led to higher emotional non-acceptance at the beginning, but PTSD level did not predict to emotional non-acceptance over time. Next, initial emotional non-acceptance positively predict both anxiety at the initial time point and anxiety over time. In addition to this, change in emotional non-acceptance over time positively predict anxiety over time. Lastly, individuals with higher initial anxiety show a more gradual rate of increase over time, whereas those with lower initial anxiety demonstrate a steeper rate of increase. Lastly, the Sobel test result indicate that the relationship between PTSD anxiety and anxiety over time was significantly mediated by initial emotional non-acceptance. However, initial emotional non-acceptance did not significantly mediate the relationship between PTSD and initial anxiety. Here is visual summary of our model. Um, for your reference, a solid line means significant result, and the dot line means non-significant.
Okay, now turning to the discussion, Yongsu, can you move on? Yeah, thank you. Our findings shed light on how PTSD, emotional non-acceptance, and anxiety unfold like over time. And we found that the higher initial PTSD levels like predicted greater like emotional non-acceptance, which suggests that individuals with more severe PTSD symptoms tend to struggle like more with accepting their emotions like from very start, which also in turn like high emotional non-acceptance like predicted like both greater initial anxiety and increase in anxiety across time. What makes this study interesting from here is that though emotional non-acceptance only mediated the pathway from PTSD to like a long-term changes in anxiety, but not to initial anxiety levels. So this pattern kind of like indicates that like rather than PTSD directly like producing like anxiety, emotional processing difficulties, such as like emotional non-acceptance in our study, act as the bridge, like linking the two like over time. So in this slide, we also talked about this emotional non-acceptance. Actually, emotional non-acceptance really showed a steady, like a linear increase, like over time. And although like some participants like differed in where they started, like their overall rates of increase looked pretty similar. So this pattern really tells us that non-acceptance is not like a fixed trait. It really tends to worsen like gradually if not addressed adequately. And also, this also kind of supports our earlier research, other research, suggesting that people with PTSD like often rely on ineffective regulation strategies that reinforce like emotional like avoidance. And our findings kind of really extended this understanding by showing that emotional non-acceptance may be like an evolving feature after like any exposure to traumatic experiences, not something like a static. And while PTSD severely also shaped the initial level of non-acceptance, it didn't really predict like how non-acceptance like change over time, which also suggests that early emotional functioning sets the stage, but there might be like other factors that might also drive in these ongoing changes as well. So in terms of the anxiety, though, anxiety patterns looked quite different. Like we found that anxiety like varied like widely like among individuals, and some participants' anxiety increased, some others decreased, and some others like it stayed pretty stable. And this variability really highlights that anxiety after trauma is highly individualized, which kind of really makes sense, right? And we also saw that the higher initial anxiety was also linked to slower increase over time, which is kind of a ceiling effect, and where those already at higher levels didn't increase like much further. However, in contrast, participants like starting with the lower anxiety also show like steeper increase. So these findings remind us that like post-trauma anxiety doesn't have to like follow like a single path, right? It can depend on some other factors, whether, you know, what kind of coping mechanisms the person might have, whether this person has any access to different types of social support, or even like biological difference in their stress responses as well. So when we examine like how PTSD connects to like a long-term anxiety through emotional non-acceptance, which is also important pattern emerged like from our study. And as I mentioned a little bit earlier, emotional non-acceptance again acted as a key link, which predicted like both baseline anxiety and its growth trajectory, but only mediated, right, the long-term pathway from PTSD to anxiety. So this suggests that PTSD contributes to enduring like anxiety, mainly through the difficulties in emotional processing of individual. And we actually came up with this emotional processing theory here, which kind of helps explain this. So, which means to reduce the fear, individuals must activate and process their emotional memories. But if they avoid or reject these emotions for some reasons, they lose actually those opportunities for corrective learning. So emotional non-acceptance really blocks the emotional processing needed for any recovery process. And we also want you to take a look at this aspect from more cultural context, given our sample was Korean. And if you think about this Korean cultural context where emotional restraint is also often seen as a social virtue, this distinction becomes very critical, which might differentiate like between the culturally appropriate restraint and maladaptive avoidance is essential like for understanding the trauma recovery. So from here, I'm going to have a Yongsu to share some about implications for practice and also limitations and the directions for the future study as well.
Thank you, Dr. Chung. Let's talk about implication. First of all, early intervention should focus on emotional acceptance to prevent long-term anxiety symptoms in people with PTSD. Personalized therapy such as trauma-informed and or mindfulness-based intervention can be applied to support for this population. Next, regarding the proactive intervention, early screening on the emotional non-acceptance can help identify those at higher anxiety risk in advance. Lastly, PTSD treatment should target both primary and secondary emotional responses to assess this population to develop appropriate coping strategies. There are several limitations and future direction. First, we already use emotional non-acceptance as a mediator. So, examining broader emotional regulation difficulties such as impulse control or goal-directed behavior could expand our understanding on the relationship among variables used in this study. Second, our data show no change of PTSD over time due to the characteristic of this current study. Therefore, assessing PTSD changes over time can give different insight on the mechanism among the variables. Next, further research should identify subgroups of PTSD by using latent class or proprietary analysis and gross mixture modeling to examine how distinct PTSD group impact on emotional non-acceptance and anxiety over time distinctively. Lastly, our participants are only Korean. Given the fact that there are differences in emotional regulation strategies between collectivity cultures and individual cultures. So further research should conduct a cross-cultural study to explore how cultural difference in emotional regulation influence PTSD and anxiety progression over time. This is the reference used in our study. Thank you for your attention. If you have any question, please send an email to our team. Thank you.
Thank you, everyone.